Many women experience discomfort during their menstrual cycle. For some, this discomfort is mild. For others, it can be severe enough to disrupt daily life.
This is presented to you by Education 4708. Just proceed to view the full content.
Disclaimer: the content on this channel is meant only to provide helpful insights, tips, and information on certain subject or topic. While we strive to provide accurate and up-to-date knowledge, this is not a substitute for professional advice. Always consult a qualified expert or professional for your specific needs. We encourage you to use this content as a guide for learning and additional information. If you think this does not fit what you want, please skip the video.
This pain, known medically as dysmenorrhea, is very common. It's important to remember that you're not alone, and that effective treatment options are available. Dysmenorrhea is characterized by cramping pain in the lower abdomen. This pain can radiate to the lower back and thighs. While it's typically associated with the onset of menstruation, it can occur before and during your period. The good news is that most women experience primary dysmenorrhea, which is not caused by an underlying medical condition. However, some women experience secondary dysmenorrhea, which is caused by a medical condition affecting the reproductive system. Understanding the difference between these two types is the first step in finding the right approach to manage your menstrual discomfort and improve your quality of life. Dysmenorrhea, or painful periods, is classified into two main types, primary and secondary. Primary dysmenorrhea is the most common type and is not caused by an underlying medical condition. It typically starts a year or two after a woman begins menstruating and is thought to be caused by the natural chemicals involved in the menstrual cycle, such as prostaglandins. These chemicals cause the uterus to contract to shed its lining, leading to cramps. Secondary dysmenorrhea, on the other hand, is caused by an underlying medical condition affecting the reproductive system. Conditions such as endometriosis, uterine fibroids, or pelvic inflammatory disease can cause more severe menstrual cramps. Recognizing the symptoms of dysmenorrhea is crucial for seeking appropriate treatment and relief. While the hallmark symptom is cramping pain in the lower abdomen, the experience can vary from person to person. Some women describe the pain as a dull, aching sensation, while others experience it as sharp, stabbing cramps. The intensity and duration of pain can also fluctuate, with some women experiencing discomfort for a day or two, while others endure it for most of their period. In addition to cramping, other symptoms may accompany dysmenorrhea, such as lower back pain, pain radiating down the thighs, nausea, vomiting, diarrhea, headache, fatigue, dizziness, bloating, and breast tenderness. If you experience severe pain or unusual symptoms, it's essential to consult a healthcare professional to rule out any underlying medical conditions. As we've discussed, the causes of painful periods differ depending on the type of dysmenorrhea. Primary dysmenorrhea, the most common type, is not caused by an underlying medical condition, but is linked to the body's natural production of prostaglandins. These chemicals, while essential for the menstrual cycle, can cause contractions in the uterus that lead to pain and discomfort. Factors like stress, smoking, and obesity can worsen primary dysmenorrhea. Secondary dysmenorrhea, on the other hand, stems from underlying medical conditions affecting the reproductive system. These conditions include endometriosis, where tissue similar to the uterine lining grows outside the uterus, uterine fibroids, which are non-cancerous growths in the uterus, pelvic inflammatory disease, an infection of the reproductive organs, and adenomyosis, where the uterine lining grows into the uterine wall. Identifying and addressing these underlying conditions is crucial for effectively managing secondary dysmenorrhea. While seeking professional medical advice is essential for managing dysmenorrhea, particularly in cases of secondary dysmenorrhea, several self-help tips can provide relief and improve your quality of life. Applying heat to the lower abdomen can help relax the muscles and alleviate pain. Using a heating pad, taking a warm bath, or even filling a sock with rice and microwaving it for a minute can provide soothing warmth. Over-the-counter pain relievers, such as ibuprofen or naproxen, can effectively reduce inflammation and pain. It's essential to follow the recommended dosage and consult a healthcare professional before taking any new medications, especially if you have underlying health conditions. While self-help tips can provide relief from dysmenorrhea, seeking professional medical help is crucial for diagnosis, particularly for secondary dysmenorrhea. A healthcare provider can perform a pelvic exam, ultrasound, or other tests to identify any underlying medical conditions contributing to your pain. Treatment for dysmenorrhea varies depending on the cause and severity of your symptoms. For primary dysmenorrhea, your doctor may recommend over-the-counter pain relievers, hormonal birth control, or other medications to reduce prostaglandin production. For secondary dysmenorrhea, treating the underlying condition is key to managing pain. This may involve medications, surgery, or other therapies depending on the specific condition. Remember, you don't have to suffer in silence. By talking to your doctor and exploring available treatment options, you can take control of your menstrual health and find relief from painful periods.
If you find this video helpful, leave thanks comment in the comments section. Thanks for watching.